emergence of COVID-19 vaccines has generated immense excitement as the world continues to strive towards a permanent solution to the pandemic. However, in the course of rolling out these vaccines, the availability of cold chain solutions has remained a challenge for many countries. Now joining us to talk about this is the co-founder, CEO of GRICD, Oghenetega Lortim, whose company is rolling out cold chain solutions in Nigeria for vaccines, drugs, and other commodities. Tega is an information communications technology major of Covenant University. He has managed multiple development projects that process over $1 million in annual revenue and has worked on technology development initiatives across multiple industries, including power, manufacturing, agriculture, and oil and gas. Welcome to the morning show. Good morning, Tega.
Thank you. Good morning.
Tega, good morning. I had a challenge earlier on pronouncing the name of your company. Is it GRICD or GRICD? How do you pronounce it? Let's start with that.
So it's pronounced as GRICD. GRICD, GRICD. You can call it GRICD or GRICD.
Okay, the C is silent, right?
Yes.
Okay, very quickly. This morning, I see you are involved in rolling out cold chain solutions. And we seem to have a major problem in Kogi State, where we're told that Kogi State cannot take the vaccines. Hence, those who want to take the vaccine, COVID-19 vaccine in Kogi State have been denied the opportunity to have it. Now, how do you think that Kogi State can solve that problem in quick time so that this situation that we have, only one state out of the federation not being able to provide cold chain storage, can just join the rest of Nigeria to fight this battle, this public emergency, called the COVID-19 pandemic?
Yeah, so I think for Kogi, what's happening in Kogi State is pretty unfortunate at the moment. But I think that there are a lot of technologies on the market which could be explored. So you have both the active and passive technologies on the markets which could be explored. I think for Kogi State, what they could do is to explore the passive means of technology, and then also inculcate the use of real-time monitoring technology, which would basically ensure the efficiency of the passive technology. As a company, what we do is basically offer that real-time monitoring for temperature-controlled products. So irrespective of whether you're using active or passive, you have the ability to actually ensure that the products are being stored under the right conditions, and then if there are escalations or excursions, then you can actually have access to that information as well and discard. So I think the question is, you could actually make use of any technology. Real-time monitoring basically is just the most important function for effective vaccine distribution at the right temperature or potent conditions.
Right. So it's been said that Nigeria currently has just 1% of the world's cold chain storage and mobile refrigeration logistics capacity. That sounds pretty low. So can you tell us what the picture does look like? Because, data is nothing without its proper context. Can you put that data into its correct context in terms of the COVID vaccine rollout?
Yeah. So when you're looking at 1% of cold chain storage, when you look at Nigeria has about 10,000 primary healthcare centers. So if you're looking at, how many of these primary healthcare centers are equipped with cold chain? Not a lot is the response. I mean, we've seen a lot of positive impact from the state and federal governments as regards supplying procurement of cold chain equipment for some of these facilities. But like I said, to kind of get us out of this, I think Nigeria is in a very unique space where, our health budget isn't a lot. So I think there needs to be acquisition of available technology, which I also think it could be active or it could be passive. But I think for storage of temperature-controlled products, the key thing is still the monitoring, which I hinted on earlier. Because at the end of the day, you want to ensure that the products are potent. So take, for example, the AstraZeneca vaccines for the COVID-19, they need to be stored between 2 to 8 degrees. And if you could actually make use of the passive technology, or you could use the active technology, but just ensuring that they are potent is what is key. So, I mean, we're in a dire situation where, yes, we don't have a lot of cold chain, but I think that there's a lot of solutions, or I think there are solutions to work around this problem at the moment.
Okay, Tega, everything you're saying now sounds very esoteric. It's too techy for me this morning. I want you to break it down to the average now. You're saying passive, active. I don't want to hear that. What is the technology? What is the monitoring system? Are you storing them in buses? Are you storing them in ice packs? How are you ascertaining temperature by size? With your services, can we afford to say, okay, we can get AstraZeneca vaccine now and store at minus 80 degrees? Break it down with examples. I want to hear it. Let it sink in home for me.
Okay. So basically, as a business, we have two solutions. One is a real-time data logger, while the second is a cold box. And behind this, we have like a software which enables businesses monitor in real time. So for the first technology, it's an active cooling, more like a mobile refrigerator that has the ability to cool up to minus 30 degrees. So we may not be able to do the Pfizer vaccines at the moment, but we will be able to do like the Moderna, AstraZeneca if it needs to be 2 to 8 degrees. So we can store up to minus 30 degrees, while also offering real-time information as regards the location of these vaccines, as well as the storage conditions of these vaccines. While the second technology kind of works with any available existing cold chain infrastructure. So even if you're used to using maybe coolers and ice packs, or the styrofoam boxes and ice packs, which could also work for your typical 2 to 8 degrees, we have real-time data loggers, which could be put alongside those products and then communicates in real time the location, temperature of the vaccines. And why we track this information in real time is because for two reasons, right? One, when you're losing products don't just go bad instantaneously. They need to be exposed, or there needs to be an excursion for a long period of time. So you need to be able to, once you have an excursion, you get an alarm so that you can actually take proactive measures, to curb those losses. And then secondly, while you want to monitor location is for security purposes. In a place, we all understand what the security situation is in the country today. So you want to be able to monitor and geofence products while they're in transit, because you don't want it getting into the wrong hands at the time. So that's why we provide that real time monitoring. So those are the two products for us that we offer as a company.
Well, Tega, we've been talking in relation to vaccines, but I'm sure that cold storage could also be applicable in other ways. For example, agriculture, where there is a lot of wastage because we don't have so much capacity to be able to, store agricultural products. I would like you to comment on that. And then secondly, talk about the challenges, the specific challenges that you face within your line of business, the logistics industry.
So cold chain cuts across, the effect of cold chain, or the value that cold chain brings, cuts across many sectors. Agriculture, healthcare, we've seen its application in oil and gas. And so take, for example, agriculture, for example, in sub-Saharan Africa, we have a very dire condition where we have about 200 million malnourished, undernourished people. And we're losing about, close to 50% of the food which we produce. And I think one of the major challenges that we've identified has been, the lack of cold chain to preserve these products. And when you look at some of the challenges that are associated with cold chain and some of the technologies that do exist in the market, it is heavily reliant on, existing infrastructure in the sense that you need power, as a basic form of, keeping the products cold. And because of the whole power issue, it becomes really, really complicated, because a lot of the parts where there's farming activities, there's no grid access. But I think with more recently, we've seen companies that have begun to spring up and adopting solar technology to, ensure that, or to power cold rooms, basically. Power cold rooms. And also we're seeing a lot of local technology like ours that are coming into this space that also understand some of the challenges that exist in this African market, thus are building solutions that that work irrespective of the infrastructural challenges that exist in the market. But I think going forward, I think you'll see a lot more of these solutions, and I think if the government looks into some of the solutions that also exist in the market, they'll see that a lot of the solutions on the market could actually solve a lot of the problems that exist. It's quite dire. Cold chain is quite dire because it cuts across, like I said, various sectors and impacts on human, livelihood, human life, and even healthcare, you know. So something that needs to be resolved.
Certainly. Can you take us through some of the regulatory challenges that exist for you, and how would you like to see them addressed?
So, especially when you're trying to play in the healthcare space, I think there are a number of regulatory issues. Well, I wouldn't say issues. I think those regulations are in place to, ensure the safety of the products that are being consumed at the end of the day. Because cold chain is basically just supply chain, and ensuring that those things are being moved properly are key. But some of the regulations that I think you have to get is things like your PQS certification issued by the WHO. You also need to get your Sunman cap. You need to get a few of these other certifications. But I think what could really be helpful from the side of the government would be, creating strategies or programs which could help innovation in this space, basically. I think we've spent about 3 years, so we're acquiring a lot of these certificates. We're getting to a point where, the technology is being adopted. But I think in early stages, it was really, really difficult in the sense that you have an idea, you have a dream, and then you're trying to build it, and everybody wants to know, what's your background, what do you have, what certifications do you have, is a really tough barrier. And I think to further push innovation, I think you need to come up with strategies that ensure that people with ideas and dreams, especially in solving some of these critical problems, could really be spurred to success.
All right, so Tega, we'll go on a quick break now, but before then, I want you to talk me through the challenges you face to finally get vaccines, for instance, to the last mile. So take, for instance, I'm rolling out from Abuja. I want to go to Potiskum local government area, probably a village in Potiskum. How do I get down the last mile where probably there's no motorable road, so I need to carry the ice boxes on a motorcycle to get 1 hour down the line to get into that village to be able to get people vaccinated?
Yeah.
What is it like, that last mile journey? And secondly, you talked about geolocation. So are you saying that your technology has like geolocation chips on the vaccine box that from your control center in Lagos, I could probably see where the vaccine is in a village in Potiskum? Is that the case?
Yeah, thank you. So yes, I'll talk about how our technology helps solve that problem of transporting to the last mile. So for our cold boxes, they are active cooling, like I mentioned earlier. They are mobile refrigerators that have IoT embedded in them. So for movement to the last mile, the boxes are portable, like I mentioned, can be integrated into vehicles, can be integrated into motorcycles. We've used these things on boats. They have internal batteries, so they are active in the sense that they can run on batteries for as long as 72 hours. So even if you have to get into some of the toughest regions on battery, it will last for about 72 hours, and then you're able to preserve the integrity of the products being transported to the last mile. And to the second point, yes, it has a GPS module which shows in real time. You can be in the US. We have some clients at the moment that are private businesses that could be in the US, and then they could monitor in real time, where their refrigerated asset is. So if it's vaccines, you could tell that, yes, it's in Potiskum in Borno State, and then you could also see what the temperature is. If it goes above 2 to 8 degrees, in the case of AstraZeneca, then you have an alarm system, being triggered instantaneously, telling you that there's something wrong with the product. So those are some of the things. We've also embedded like solar panels into the system. As such, in the last mile, you could also, preserve that integrity through and through.
All right, thank you so much for that, Tega. We'll go for a quick break. We'll come back. We'll talk.
Thank you very much.
Welcome back to the morning show here on the Arise News channel. Our guest is still Oghenetega Lortim, whose company is rolling out cold chain solutions in Nigeria for vaccines, drugs, and other commodities. Now, Tega, quickly, we've been talking about issues around your area of business, but could you give us a picture, just paint a picture for us of the cold chain startups ecosystem in Nigeria and how much support you get from government, because I'm sure you can make do with government support in specific ways. And then you go from there to tell us what the business model is for your company, GRICD.
Thank you very much. So at the moment, if we look at the way the cold chain infrastructure is set up across Nigeria, at the moment, when cold chain products like vaccines get into the country, you have, three major points where they're disseminated. That's Lagos, Abuja, Kano. And then from there, moves to government houses. And then from there, it could move to the community healthcare clinics. I think the challenge actually lies from that state facility to the last mile. And I think that's where the problem lies a lot. Lies when you look at, the challenges that exist. And for us, what we're trying to do is to, enable, bridge that trust that occurs in cold chain at that last mile gap. And then, we've built solutions around that. So at the moment, when you look at, we've actually had conversations with the Ministry of Health and also, NPHCDA. So we're hopeful that, we could, because I think our solutions are really, our solution at the moment is really pivotal to ensuring that products do get to the last mile. Because if you look at interacting with the everyday person in Nigeria, there's a trust issue around the cold chain and how if the government is able to properly handle the cold chain. So, but I think with our solution, you're able to prove to people that you have done that successfully. At the moment, what we're trying to, in terms of business model in relation with the government, what we're offering is, available tech that actually could be purchased, and then with the software and setup of OCCs, which basically gives the Ministry of Health the ability to, monitor in real time where all the vaccines are as they are being distributed and what conditions they are being transported at. So, in a nutshell, what we're doing is that we have refrigerated technology that could be given to the government alongside software for real-time monitoring.
Have you had any incidents so far of spoilage, and how was that dealt with?
So with the real-time monitoring feature, you do have excursion alarms which happen almost immediately, and once you have that, then you could actually take proactive measures. So take, for example, the AstraZeneca vaccine, which we're all familiar with. AstraZeneca vaccines can stay about 2-3 hours, under room temperature. And that's why the IoT or the excursions alarms are very, very critical. So for us, once we have that excursion alarm, immediately, you need to take proactive measures and see, okay, what's wrong here? How do we resolve that problem? And then ensure that that problem is resolved within the hour to ensure that you're able to preserve the product. So at the moment, no, not yet.
All right. Okay. Real quickly, I just want to ask about capacity. So what's the capacity like? What capacity can we do? We had close to 4 million vaccines churned in, more still to come in the country. What kind of capacity? What's in a case where we have over 50, 60 million vials of vaccine? How can the cold boxes store all this and distribute effectively? What's the range like? Yeah.
So we have thousands of the boxes and are able to roll out as quickly as possible. So in the case of unlike what we're seeing with most state governments, the model is kind of like an incremental model where you have the people of higher hierarchy in the government get the vaccines first. Then next it will be the people who are within the healthcare space, then the press, and so on and so forth. So we do have the capacity to support this alongside the state governments, which are pretty much handed the responsibility to handle the last mile distribution of the vaccines. So yeah, there's capacity to support this alongside with the state governments.
Quickly, earlier on you talked about solar powered solutions. Do you want to comment a little bit more on that? Because when you were asked the question about how you get the vaccines to the last man, you mentioned solar. How does that work in Nigeria, and how easy is that?
Yeah. So for if you look at a lot of the primary healthcare centers in some of the very hard to reach locations, you would discover that lack of access to grid is a major problem for a lot of these places. So what we've done on our technology has been to ensure that the the refrigeration consumes minimal power. And with minimal power, you can actually, recharge or power it with smaller, solar units, which are not very expensive in comparison to when you're trying to power, the refrigerator in your home. But this is relevant for hard to reach locations that actually lack access to GRID. Out of the 10,000 primary healthcare centers, I really don't have the data, but I know that a significant number of those do not have access to the GRID.
Well, even in the absolute disaster that this pandemic has been, there's opportunity, especially for somebody like yourself. How are you planning to take advantage of it? I mean, earlier you briefly discussed agribusiness. How are you planning to leverage on this situation to grow your business?
The pandemic has been quite unfortunate, and we're quite, blessed to play a role in bringing this to an end. And so for us, what we're doing has been to, look for how we could, source partnerships with both private and public organizations to, strengthen the cold chain, because we need to be ready. We need to strengthen the healthcare space, basically. And cold chain is going to play a major role. If you look at a lot of the medications that are being produced for the future, a lot of them are dependent on an effective cold chain. If you look at even sample collection from the last mile, a lot of them are dependent on effective cold chain. So what we're basically trying to do at this point in time is to, take advantage of the fact that people are paying attention. People are paying attention to some of the issues that exist, and trying to play a part in fixing some of these crucial problems along the lines of healthcare and also agriculture. So we're blessed to play a part in trying to bring a close to, or draw the curtains to this horrible pandemic. But we would leverage on partnerships to build a stronger healthcare and agriculture, or even supply chain, basically across the country.
And what are those partnerships you've been seeking thus far, real quickly, and how have they helped? Because by now, I think with this kind of solutions and this technology you have, and by the way, have you patented this technology? I think you should have some solid partnership with government now to be able to help you scale and help a lot of people.
Yeah. So one of such partnerships is with logistics partners across the country. What we're trying to do is, with the logistics businesses, they're in the space of moving larger agro products, right? Which is fine for, when you're doing intrastate ton per ton movement. But now there's a unique challenge, which, like I mentioned, is the last mile. So what we're basically doing is, how do we provide infrastructure to the logistics businesses to ensure that, they get to the last mile effectively. So those are some of the partnerships that, that's one of the examples of partnerships which we're also trying to leverage. The second partnership is, partnering with the telcos. How could the telcos start providing priority networks or network access, for data collection, just to validate or invalidate the potency of vaccines that are being transported, to the last mile. So these are some of the conversations that we're having, and some of the partnerships that we've already brokered at the moment to ensure effective or potent vaccines do get to the last mile, and get to the last mile in the right conditions.
Well, thank you very much, Oghenetega Lortim, for joining us, and we wish you all the best.
Thank you very much.
Thank you very much indeed.